Hi everyone, this is Mr Neil, consultant audiologist and director of Earwax. Thank you for joining me in my latest demonstration video of our recently developed wax scope. Now, the pre-procedure video there was taken with the Audiologist endoscope, and now for the procedure I'm using our wax scope. Now this is a very complex case. This patient has to attend every 9 months, and the reason for that is that they have a chronic impaction of very dry, abrasive earwax. So the surface of this wax and keratin, I should say, there's a lot of keratin there. It's very abrasive, it's very rough, it's almost like sandpaper. So for that reason, it's very difficult to remove because the patient can feel it against the canal wall, and it can sometimes be a bit uncomfortable. Therefore, with this particular patient, we always recommend them to use some drops prior to attending, just to see if we can soften the surface. But despite the patient using drops for a few days, the surface is very, very rough still. And in addition, once I remove this large plug, the patient has very sharp and very uncomfortable for him shards of dead skin. It's almost like glass in the ear. And you'll watch me not only remove this very hardened keratin wax, but also shards of dead skin, including on the eardrum as well. Now, you can see the oil in there. It has lubricated it slightly, but when you've got wax and keratin this hard, it's sometimes very difficult to get a suction grip. And the slight problem is that you can push this further in because you're not getting a grip with the suction probe. You've got to really hover it over the surface, and if you put too much pressure against it, you're just going to be pushing this plug further in and impact it against the eardrum. And the patient was quite astonished at the end of the procedure. They actually got some clumps of wax and skin and rubbed it between the fingers, and they saw how hard it was. Now, this is a very good case for me to do the wax because it's one of the more complex ones. And typically, I don't recommend my clients having to use any drops prior to attending, but I've probably got one in 100, for example, of clients that I do recommend to use drops because I know it's going to benefit the procedure, and without using the drops, it's going to be very difficult. So it's a real good test of the wax scope, this was. Now, if anyone, more so people who have never used an ENT microscope, or members of the public who